Today, we are posting new guidance on screening in schools and when schools should pause in-person learning due to COVID to our website. As a reminder, schools have a number of safety measures in place to prevent spread and to protect those too young to be vaccinated. First, everyone in a school building must be masked except when they're eating or drinking. Schools must enable physical distancing where they can, provide opportunities for good hand hygiene, and provide a clean site. We strongly recommend that everyone who's eligible be fully vaccinated. And finally, all schools in Philadelphia have to follow our guidance on contact tracing, screening, and quarantine. We've changed our recommendations on screening testing, and we are now asking that schools follow the CDC's guidance to conduct weekly screening testing for unvaccinated students where possible. This is consistent with the CDC's recommendation that screening testing be offered to students who have not been fully vaccinated, where community transmission is at moderate, substantial, or high levels, such as those in Philadelphia right now. Screening testing should also be offered to all teachers and staff who have not been fully vaccinated, no matter how much community transmission there is. We are also now including test to stay as an option for schools. This means that schools could allow close contacts of someone who tests positive in school to avoid the need for quarantine if, and this is a big if, the school is able to offer frequent rapid testing and the child tests negative every other day for a week. Next, our recommendations for when schools should pause in-person learning have also changed somewhat. First and most importantly, anyone who has COVID symptoms or doesn't feel well should stay home and get tested. When 1 or 2 people in a school test positive, their close contacts should quarantine for up to 10 days if they're unvaccinated. If they're vaccinated, they don't need to quarantine, but they should get tested 3 to 5 days after that exposure, so long as they don't have any symptoms. And they should make sure to mask in public. And I'll say that everything I'm saying here in terms of this protocol is on the website. If 3 people in a class test positive, that class should pause in-person learning for 10 days. If those 3 positive cases are in different grades or classrooms, the school should treat them like individual cases and just quarantine their close contacts. In the case where 6 or more people test positive in a grade, the school should call the health department immediately and discuss needing to pause in-person learning for the entire grade. And if 3 or more grades are paused, or more than 3% of the entire school community tests positive, the school should call the health department immediately and discuss needing to pause in-person learning for the entire school. This new guidance is less strict than our guidance before because we've seen that our other safety measures have been successful in containing spread and because we're watching and learning from containment efforts in other places. We believe that it's possible to prevent wider spread of COVID in schools and keep kids in school. This does not mean that there won't be COVID in our schools. Community transmission is high enough that some students, staff, and faculty will be exposed at home or outside of the school and could bring it in. But with daily symptom screening, 100% masking, contact tracing, and vaccinations, we can stop that person from spreading COVID to others while in school. As with all of our guidance, we'll continue to monitor the situation in our schools and may change this guidance again if needed.